All right, looks like we've got most everybody. Okay, welcome to today's It's Worth a Shot. We appreciate everybody joining us every Wednesday as you continue to do it. And today we're going to go over Area Health Education Centers, or AHEC, if you've heard of those before. Next slide, please. As always, we want to let you know that this presentation is presented by two outside presenters from that are not with Mountain Pacific. And so we just want to make sure you guys know that the information provided does not constitute endorsement or recommendation by Mountain Pacific. We just like to get that information out there for everybody to see and listen and decide for themselves. Next slide. Okay, we have a couple reminders here. So there is a National Prescription Drug Take Back Day. That is going to be on the 26th of October. And I believe in most cases it's between 10 and 2. So it doesn't really matter which time zone you're in. That's kind of generally the times, but we do have that QR code there. So if you go ahead and scan it, you'll be able to find local places around you that will be doing the take back. And then also, big surprise, you guys have probably seen a lot of emails coming from us, but October 13th to the 19th is the International Infection Prevention Week. So if you want to read some more on that, we also have a link, but also we want to say thank you for all that you do to all the infection preventionists on the call. Without you guys, we would all be in a lot worse shape. So thank you for your dedication and your time and your efforts, even though it might seem like a thankless job most of the time. Next slide, please. All right, so going off that International Infection Prevention Week, we did just get an email from Rebecca Hamill from the Alaska Department of Health, and she's an infection preventionist. And we just thought this was kind of neat, but there is a Wordle on there that you can complete that has to do with Infection Prevention Week. And also, we thought this little pictogram is kind of interesting. And I'm sure you guys can all kind of get the joke. All right, next slide. So again, we want to thank you guys for joining us every Wednesday for these webinars. I believe we are now actually up to number 138. So we've had 138 Wednesdays together, not always consecutive, but we appreciate you tuning in. Mary will put an evaluation into the chat, and we really do appreciate you guys filling that out. It does let us know topics that want to cover, or if a topic we covered was great and you want more of that, we do read those and pay attention to them. So if you guys can complete that for us, we really, really would appreciate it. Next slide. Okay, so our weekly influenza snapshot. Again, we're still looking pretty good, staying about flat on what's happening with the respiratory illness. And apparently the flu surveillance has not really been updated much, because I'm doubting that it's 0, but if it is, that's great. Let's go to the next slide. And as we can see, COVID is kind of starting to pick up now, not huge. As you can see, the 0% change from the previous weeks, but it does look like the colors on the map are kind of shifting more towards the right when they previously were. But next slide. All right, now I'm going to pass it over to Sarah Matter and Chloe Williams, who will be doing the presentation today. If you ladies want to come on and introduce yourselves, we'd greatly appreciate it.
Yes, thank you. Thank you for having us. Me and my partner Chloe here are here to talk about Area Health Education Center and how we can be a resource for you all. Next slide. So like I said, I am Sarah Matter. I am the South Central Montana AHEC Program Specialist, and we are located at Montana Hospital Association here in Helena. And I've been with AHEC since January. I'm super excited to be here and present to you all on more about AHEC. And I'll let Chloe introduce herself.
Awesome. Thank you so much, Sarah. And thank you all so much for allowing us to take some of your time this afternoon. I apologize for my voice. Obviously, I have gotten a cold from my little one from daycare. However, I'm Chloe Williams. I'm the North Central Montana AHEC Program Specialist. I was formerly the North Central Montana AHEC Equity and Community Engagement Specialist during the CDC COVID-19 grant. And I've been at MHA as a part of AHEC for a little over 2.5 years now. Once again, thanks so much for this opportunity. Next slide.
you want to present on this, Chloe, or?
Sure, yeah. So if you all are not familiar, AHEC is Area Health Education Center. Most states across the country have an AHEC, if not all the states. And a big goal of AHEC in general is to, our mission essentially is to help supplement and support healthcare workforce. And so as you can see, broken down across the state, we have 5 AHEC centers. Basically, our program office is in Bozeman because each AHEC office has to be within a medical school. And at the time, the closest we had was MSU Nursing. So it lives in Bozeman. My region is that light yellow region going from Marr County all the way up to the High Line. Sarah's region is that green region, Lewis and Clark County, down to Beaver Head. And so both of us, while we work and live in Helena, we are often traveling around our awesome regions, working with schools and hospitals to help support healthcare workforce. Sarah, I didn't know if you had anything else you wanted to add.
Not here. I can touch on the next slide though, if you want to
Okay.
move forward. So one of our main focuses is introducing high school students to different healthcare careers. So that's a large part of what our job entails. And so we start by doing that by different programs that we offer. So we have summer camps. Our MedStart and our Heads Up camp are both held in the summertime. MedStart is statewide, so each region hosts a MedStart within their region. And this is a 5-day camp. So in my region, we alternate between Butte and Bozeman, Montana, and then Chloe's region is Great Falls. So students are able to stay on college campus. It's a 5-day camp. They're able to shadow the local hospital. They're certified sometimes in CPR and Stop the Bleed, and it just really opens their eyes to all the different hospital type healthcare careers that are out there. Usually there's a fee of $500, but with Chloe and I being housed under Montana Hospital Association, these are free for high school students in our regions. So they eat and they sleep on the college campus. And then we do some fun activities with them, after they are done for the day, learning about all things healthcare. So it's a really fun camp. Our Heads Up camp is very similar. That one is held in Helena, Montana. We partner with Schroeder Children's Hospital, and it is also a multi-day program held at Carroll College, but that one is focused on careers within behavioral health. So similar, but we partner with different behavioral health organizations to come talk to students about that. Our REACH camp is our 1-day program where we partner with a local healthcare facility and a high school, and the high school students are able to go visit that healthcare facility in a 1-day format. So I recently did this in Deer Lodge, and they were able to visit all the different departments within the medical center there. And so very fast paced. They do a lot of fun hands-on activities, such as, suturing chicken breasts. They injected oranges with saline. They were able to take an ambulance ride. So they were just really introduced to all those different departments in a very fast-paced environment. Lastly, Chloe and I attend a lot of college fairs and are able to give out resources for students that are interested in healthcare. So, Chloe, did you have anything to add on this one?
One thing I would add is that we really strive to make sure that our students who are attending our longer camps, so our 5-day camps, are certified in something, be that Stop the Bleed, kind of like Sarah had mentioned. For Heads Up, they are
yes, yeah.
certified in teen mental health first aid, which is an evidence-based program that allows peers to be able to support peers when it comes to mental and behavioral health. And our hope there is to help bridge some of that lack of behavioral health resources throughout community. So just something interesting. We, as Sarah mentioned, MedStart for North Central and South Central AHEC is fully funded by at least this year, and has been historically by our for-profit arm, Ventures, which is really fortunate. However, these camps are held in every region across the state. So there are opportunities for students in every community to apply to any of the different regions that they're interested in to attend this camp for 5 days. When it comes to Heads Up, we are fully funded for that too by OPI. So have a lot of really wonderful community support for our camps. But I think that's pretty much all I have to
Yeah.
add, Sarah.
Yeah, thank you, Chloe. I appreciate it.
Yeah, thank
Next
you.
slide. So another part of our job is to, start with the high school students, introduce them into those different opportunities that are available within healthcare. And then our goal is to kind of see them through post-secondary and into the workforce. So we provide resources for post-secondary programs as well. We partner with Simulation Education Training. So Simulation in Motion Montana brings a simulation truck on site, and they can deliver about any simulation that's geared toward the objective. Clinical Connect is our networking event. And then Chloe, I'll let you touch on the networking.
Yeah, absolutely. So Clinical Connect, we hold Clinical Connect during our Montana Healthcare Conference every fall. We piloted it about 3 years ago, and it's an opportunity for residents and future healthcare professionals, just kind of across the spectrum, to meet with hospitals, long-term care facilities, and different employers across the state. And it's really fun. It's really just a very relaxed environment where students can have that chance to meet with HR, with fellow physicians, with whomever that specific healthcare facility has decided to bring as their representative. And just really talk about not only their organization, but their community, and really give them that full picture that you sometimes just don't get otherwise. So those have been really wonderful opportunities for us to connect our post-secondary students and healthcare professionals with the workforce and the employers throughout the state. And we've had a very large, diverse group in terms of our facilities. We've had IHS, we have our tribal healthcare facilities, we have had the opportunity to have long-term care facilities. It's been really wonderful in opening the eyes of our post-secondary students to all of the opportunities in state, which is really what we want to focus on, is keeping people in Montana.
Yeah, and I will touch on the Rural and Underserved Opportunities Program.
Mhm.
So my background is I was a dental assistant for quite a few years, and my director is a dental hygienist. And so another fun thing that we get to do is provide third year dental students an optional preclinical training opportunity. And we are able to help fourth year dental students in the community find housing arrangements for the University of Washington students to complete their rotations in Montana. So that's a really fun thing that we get to kind of dive back into our dental background. So anything else to add to this slide, Chloe?
I would be happy to touch on Next. So Next Healthcare Leaders, it is a program that is, as it mentions, intended to bridge that transition from academia to clinical practice. However, we've done that the past 2 years, and it's been really wonderful and successful. Right now, we're kind of doing a needs assessment, checking in, doing an environmental scan, and seeing, is our target of nurses, what our hospitals are looking for, what our workforce is looking for, kind of where are we situated in providing this opportunity, and how can we make it better and really community led. So it is on hold for now, but definitely something in the future that we hope to continue and make bigger and better. Next slide, please. Awesome. And I think, Sarah, I think this is my slide, right?
Yeah.
Perfect. Sorry, everyone. So professional programs, as we mentioned, we have our pipeline programming that is specific to high schoolers, our post-secondary programming that really focuses on students after that high school age. And then we have our professional programming that we utilize to support the current healthcare workforce. So certain things that we have to support our behavioral health training, we can support that and do support that with different trainings such as teen, youth, and adult mental health first aid. I also work on the BWET grant out of our program office, which is our behavioral health workforce education and training grant. And we support a lot of professionals who are in the field in working towards extra certifications in behavioral health, once again, to bridge that need in community. So that is just one way we're really just trying. Yes, we absolutely can. I'm sorry that you guys are handling the chat. This is out of practice. But yes, so behavioral health training is something that we are really dedicated to. We also North Central AHEC provides the CNA training. It's an online didactic curriculum. And we partner up with a healthcare facility in that area to do all of the hands-on clinical work. And as you can see, costs are $350 per participant. And we have a pretty robust program that we've been building over the years. In terms of continuing education, we partner with our education department here at the Montana Hospital Association to support our partners with webinars and training opportunities, just to continue to help support our professionals with continuing education, with their CEs, whatever they're needing in order to continue doing the great work that they're doing. Lastly, we have had some really wonderful opportunities in terms of funding to support our healthcare facilities, as well as some of our camps utilizing Sim Montana simulations. And those have been phenomenal in terms of really allowing our students and our campers to experience healthcare-like scenarios in a much more hands-on format. So that has been really, really exciting. And we've been able to support a lot of our professional students, some of our nursing programs with this simulation opportunity. Next slide, please.
Yeah, so I can touch on PAVE. So PAVE is our Pathways by AHEX using virtual reality education. So we're able to use VR headsets to spark the next generation interest into healthcare careers. And this content is created by Transfer and Oculus Headset, and it provides career exploration simulations and clinical skills trainings as well. And on the next slides, I'll kind of go in further into those. So we utilize the career exploration simulations when we go to college and career fairs. We do a lot of classroom presentations to high schoolers, and they're about 5 minutes long in each of the simulations. And it really is just to spark their interest on what a registered nurse does, pharmacy technician, emergency medical services, surgical technician, and certified medical assistant. And they're continuing to expand on those simulations as well. When I first started, we had 3, and now they've expanded to 5 different simulations. And so just a really cool hands-on tool that we can use as we talk to them more about different healthcare opportunities that are available. And what I really like about Transfer is they, start with those entry-level careers that are very well needed, especially here in Montana, and a very good stepping stone into moving up higher too. So next slide, unless you have anything to add on this, Chloe.
No, I think that's perfect. One thing that is really exciting about some of these, these simulations is that it takes you through an entire, basically you travel with a patient through a simulation of, from beginning to end, getting into a car accident, who would be supporting you, and all of the different roles that can see you in the hospital. And I think it's really eye-opening. There's a lot of occupations that people just don't think about. It's usually, very much, there's a nurse, there's a surgeon, this, that, and the other, and there's so many other wonderful people involved. So I think this is really helpful in educating our students on what really is out there. And it's really fun too. Who doesn't like to play, video games every once in a while? Next slide, please. Sorry, Sarah.
No, no, thank you for adding. So that is more the career exploration that we use for high school students. Another component to these VR headsets is our clinical training skills modules. So these are about 15 to 25 minutes long. And so there's, 5 different ones for infection prevention, on hand hygiene, donning, doffing gloves, donning, doffing your gown, mask, and eye protection, etc. So it really walks you through the steps, and then it gives a test at the end to see, how your skills and what you learned throughout the training module. So these are more, we're trying to partner with local healthcare facilities, and it's just a really cool hands-on tool that we can provide when they're doing their training. And the next slide, please. And then there's, a lot of different data collection training simulations, so vital signs, respirations and pain, temperature, heart rate. And so Chloe and I actually partnered with St. Peter's Health, and we were able to use the VR headsets in their CMA program. So students were able to take a blood pressure within the VR headset, and then they were able to practice on each other. And those were about, like I said, 25 minutes long. So it really walks you through what you're looking for, what you're, hearing, how to utilize the blood pressure cuff. And so they said it was really beneficial for them to be able to do it within the VR headset and then practice live. So anything to add on that, Chloe?
I would say just in terms of like testimonial from some of our partners who have utilized or tried out the headsets, like have come to MHA and used the headsets and compared them to day-to-day working clinically. We have had some testimonials from ICU nurses saying like this would be really helpful in kind of dialing it back a little bit for some of their staff in terms of those building blocks, those things that, are just like small little things that, you have to do every day, but maybe aren't being done. And so it would be really helpful to them in terms of like repetition and supporting their workforce and the education, and making sure all of their nurses are, retaining all that same information. So we've gotten some really phenomenal feedback from our clinicians on how these can be utilized to support everyday healthcare workers. And that's been really, really, really exciting.
Next slide. So lastly, there's quite a few different simulations for activities of daily living. So, assisting with feeding, assisted with hand, foot, nail care, mouth, denture care. So we're continuing to work with different partners with these training modules. And these ones are also the lengthier ones. So it really walks the participant through each step and then tests them at the end. So like I said, just a really cool tool that we can use, and it's, different training than your, videos that you have to watch. So it's more hands-on and exciting for the participant to try out. So anything to add on these ones, Chloe?
No, once again, it's just allowing people to have that repetition and to experience things like you said, Sarah, and that more hands-on scenario versus perhaps, watching a video, reading a textbook, and really being able to put those skills to the test.
Next slide. I believe that's it. So if there's any questions, Chloe and I can try to answer them.
Thank you guys so much. Do we have anybody that wants to come off of chat, or anybody that are off of mute, or anybody that wants to ask any more particular questions on any of the programs they mentioned? Got a quiet crowd today. So like they said, that there are AHECs in, the different states and stuff like that. So we'll go ahead and try and find the contact information for the ones in Alaska, Hawaii, and Wyoming, and get that out to you guys as a resource of potentially pooling future employees, or again, entertaining some of the ones that you already have. We do have the chat, the evaluation in, okay. Jolene asked, do they have any data on how many kids complete the program and end up with healthcare jobs?
So that
Sure.
is something, oh, sorry, Chloe. do
No, you
wanna
go ahead, Sarah.
So that is something that we've been trying to implement. Chloe and I are working on sending out a survey every 6 months to see, if they went into post-secondary and if they went into healthcare workforce. So that is something that has been kind of a struggle to figure out how to track those students because, information changes, their email changes, and we kind of lose track of them. But we do ask for participants, email so that we can reach out to them in the future. So that is something that we are continuing to work on. Chloe, I don't know if you had anything else to add to that.
I think, Jolene, that is literally the biggest hurdle and barrier right now that AHEC is experiencing is how do we best and most efficiently collect that data and keep it accurate. And so we've been piloting, as Sarah mentioned, that survey to see if that's going to help us. But we really are working on the most kind of intentional way to collect that data and to continue its use. I think historically publishing house information was used, but that wasn't great either. But we're continuing to support that as best we can. Regarding the program, AHEC is around in Wyoming, Alaska, and Hawaii. I would assume Guam, but I'm not 100% sure. I have worked with folks in the AHECs in Wyoming, Alaska, and Hawaii as well. PAVE, the grant we're doing with the virtual reality, is being piloted in Hawaii also. They're one of our partners from the National AHEC organization. But I believe if not all the states having an AHEC, most have an area health education center that helps to support workforce to some capacity. Ooh.
Well, it looks like Jennifer popped a link into chat that I believe would have the directory for the AHEC
Oh, perfect. Thank you.
places.
And
Yep.
Guam is on there, so heck yeah.
Okay, good.
Oh, they might not have one, but it's okay. Yeah, we'd be happy to help direct you all to any of the AHECs and provide a warm handoff as needed. So please just let us know how we can support.
Great, that'd be great. Thank you.
Absolutely.
All right, do we have any more questions for our presenters today? No? Okay, go to the next slide, Mary. Again, I want to thank you, Chloe and Sarah. Chloe and Sarah, we really appreciate you guys coming on here and giving us some information on this. And, it's always something to think about, and especially might not pertain necessarily to the nursing homes right now, but there is a younger generation of the workforce that can help fill it out. And also a lot of people have kids and whatnot that grow up, and it's something to maybe get your kids and their friends involved in if it's something that they're interested in going into the healthcare field. So again, the evaluation is in the chat. If you guys will fill that out, we really appreciate it. We will give feedback to the presenters as well. So that is another kudos that could happen in the evaluation if you go ahead and fill that out. And then next week, we will have Tori Dahl on, and she'll be discussing the November 1st hospital NHSN reporting. And it says F884. So tune in to see what that presentation is. Thank you very much. And you guys have a good rest of your week.
Thank you.
Thank you all.
Thank you.